Hi everyone, welcome to Medical Coding Made Easy. This video is about eye and its anatomy, and before that please don't forget to subscribe to my channel for more videos on CPT guidelines. And for all the anatomy topics also I have posted videos, so you can watch that too. Now let us start with the anatomy of eye and its functions. Eyeballs are located in the face, that is in the facial bones, in a place called as orbit. And it is a cavity formed by many bones in the face together, and that holds the eyeballs. So we have a right and left orbit that holds the right and left eyeballs. And we all know that eyeball is surrounded by the protective structures like eyelids and eyelashes. Even eyebrows are some way helpful in protecting the eyes. And the main function of eye is vision. So with the help of eyes only we see the objects. Now we can go into the deeper aspect of the eyeball. What are the different parts of the eyeball? What are the different structures that are making up the eyeball, and how do we look into the objects? So now when we cut an eyeball into half, that means in a cross section, there are many different parts in the eyeball. The outermost structure of the eyeball is called as conjunctiva, and that's like a protective layer covering the eyeball and as well the eyelids. So we have two portions of conjunctiva. One is called as bulbar conjunctiva, that is covering the eyeball, and the other part of conjunctiva which is covering the eyelid is called as palpebral conjunctiva. So there are two parts of conjunctiva, bulbar and palpebral. Next to conjunctiva, the outermost layer of the eyeball which is covering or wrapping the entire eyeball is called as sclera, and that is the white portion of eyeball. So white portion of the eyeball is called as sclera. And after sclera we have the next structure called as cornea, and cornea is the clear or transparent portion of the eyeball which is helpful in regulating the light that is entering inside the eyeball. And cornea is very important because in many exams they have asked a question like this: what is the clear or transparent portion of the eyeball is called as? That is nothing but cornea. And cornea can be affected with many types of diseases also. And after cornea we have the colored portion of the eyeball, that is the circular portion in the center of the eye which is looking a little black or bluish grayish color, that is called as the iris. And after iris, at the center of the iris we have the pupil. Pupil is just like an opening present at the center of the iris which lets the light goes inside the eyeball. And behind the pupil we have the important structure of the eyeball that is called as lens. And lens is a biconvex structure. Biconvex means it looks like a spherical object inside the eyeball. And lens is held with some structures from above and below. Those are called as suspensory ligaments. And those suspensory ligaments are attached to the ends of the eyeball with a structure called the ciliary body. And the suspensory ligament, ciliary body and the lens together make the lens shrink and relax. Like whenever we are looking into a tiny object, the lens has to focus onto it. So the lens will shrink and make us look into that tiny object. So the lens is capable of contracting and relaxing with the help of these adjacent structures. And the eyeball can be divided into two portions with the help of the lens only. In front of the lens we call it as anterior chamber, and this anterior chamber is filled with a fluid called as aqueous humor. And behind the lens we call it as posterior chamber, and that is filled with a fluid called as vitreous humor or vitreous body. And sometimes anterior chamber and posterior chamber can be called as anterior segment or posterior segment. So remember that in front of the lens we call it as anterior, behind the lens we call it as posterior. Now we are moving into the posterior chamber of the eyeball. Behind the lens there is an important structure in the eyeball that is called as the retina. Retina is made up of important structures called as light sensitive cells. And there are two types of light sensitive cells in the retina. They are called as rods and cones. Rods are responsible for black and white vision, and cones are responsible for colored vision. So there are two types of cells in the retina which helps us to differentiate the objects with the help of their color. And at the center of the retina, we have a structure called as macula. And this macula is responsible for central vision. And due to aging, macula will get degenerated. So that will lead to loss of central vision. And the retina will continue towards the back of the eyeball, and it will join with a structure called as optic disc, and it will continue backwards as optic nerve. And that is the nerve which is connecting the brain with the eyeball. So information from the eye is carried to the brain through optic nerve, and it is again carried from the brain to eye through this optic nerve. And at the posterior part of the retina, there is a dip in the retina which is called as fovea centralis. And that area is filled up with lots and lots of cone cells. There are numerous cone cells that are making up this fovea centralis. So this fovea centralis is responsible for sharp vision. Sharp vision. And outside the retina, we have another layer called as choroid. And this choroid is made up of blood vessels that are supplying the eyeball. And at the junction of the retina and the optic nerve, there are no rods and cones. So that area is called as blind spot. And outside the eyeball, there are some structures which are called as extraocular structures or ocular adnexa. And mainly we have some extraocular muscles that are surrounding the eyeball, which are helping us to move our eyeball in all the directions. Because you can feel that we can rotate the eye to the right, left, up and down. We are like doing a rotary movement. That is possible because of this muscle attachment. There are 6 muscles in the eyeball which helps us to rotate the eyeball. And those muscles can be classified into 2 groups, vertical muscles and horizontal muscles. Vertical muscles of the eyeball are superior oblique and superior rectus, inferior oblique and inferior rectus. So these 4 muscles together can be called as vertical muscles because they are attached at the top and bottom of the eyeball, and that helps us to rotate the eyeball up and down. And we have 2 horizontal muscles. Those muscles are attached to the right and left side of the eyeball. They are called as lateral rectus and medial rectus. Medial means always towards the midline. Lateral means away from the midline. So medial rectus is attached towards the side of the eyeball that is facing the midline of the body, and lateral rectus will be attached to the outer aspect of the eyeball. And if there is some abnormality in the attachment of these extraocular muscles, we get a problem called as strabismus. Colloquially, we call it a squint. It is basically the misalignment of eyeball. It is because of the abnormal attachment of extraocular muscles, and we can classify it into 4 types based on the position of the eyeball. Hypotropia and hypertropia. You can see here, if the eyeball is looking upwards, we call it as hypertropia, and if it is facing downwards, we call it as hypotropia. And we have one more, exotropia and esotropia. Exotropia means if the eyeball is facing outwards, and esotropia means if the eyeball is facing inwards. And this disease can be cured by surgically correcting the position of the extraocular muscles. There are some procedures in our CPT book. Based on the muscle that is being repaired, you have to report the codes. And if in addition to the repositioning of the muscle, if they are doing some other procedure, we have some add-on codes also. So when you are checking for a strabismus correction, you have to check whether it is the correction of a vertical muscle or a horizontal muscle, and also you have to check the additional procedures when you are reporting it. That is the importance of strabismus in eye chapter. Apart from all these structures, our eyeball has got a lubricating system that is called as lacrimal system. It is made up of lacrimal glands, lacrimal canaliculi. That means there are some tube-like structures, lacrimal ducts like that. So lacrimal glands are present near the eyelids, which produces the lacrimal fluid. It's nothing but the tears that helps in lubricating our eyes. So whenever we are like blinking the eye, this tear fluid or the lacrimal fluid will spread around the eyes. So to keep our eyes wet, we are actually blinking. So that is the importance of blinking. Even nowadays you can hear that If children are watching a screen or mobile for a long time, they forget to blink their eyes. That causes a lot of dryness in their eyes because the lacrimal fluid secretion will be reduced, and also it won't flow through the eyes properly. So that is why we always advise that when a child or someone is watching a screen for longer time, it's always better to stop it every 20 minutes. Give some rest to your eyes after watching the device for 20 minutes, for about 20 seconds. Just close your eyes, give some rest, and then again you can start watching the device if you are forced to do it. Otherwise, better stop using devices. And whenever we are crying excessively, you could have felt that some fluid is coming from the nose also. That is nothing but the tear fluid only, because there is a connection between the eyes and the nose. This lacrimal system has got a connection between eyes and the nose. That tubular structure which is connecting the lacrimal sac with the nose is called as nasolacrimal duct. It's connecting the nose with the lacrimal system. So that is all about the anatomy of the eyeball, lacrimal system and extraocular muscles. Now let us move into the medical terms in this chapter. The eye and eyeball can be referred to as oculo or ophthalmo. Oculo or ophthalmo. That is why we call the eye doctor as ophthalmologist. And cornea will be called as kerato. Cornea is kerato. Then eyelids. Eyelids will be called as blepharon, palpebral and torsal. And then the lacrimal gland will be called as dacryadeno. And lacrimal sac will be called as dacryocyst. So like that, there are some medical terms. Hope these terms will be helpful for you to learn this chapter. And one more thing I forgot to mention, there is a structure called as uvea. You could have heard about this disease called as uveitis, the inflammation of the uvea. Uvea is the central portion of the eye which includes iris, choroid and the ciliary body. And these are some common diseases that affects the eye. And this chapter is a very simple chapter in the CPT book. We don't have much of guidelines in this. Hope this video will be helpful for you to learn this topic in a better way. Thank you for watching my video, and please don't forget to subscribe to my channel. Thank you.